Dr. Anu Malik now for her talk on dual polymer advantage in the management of dry eye and of dry eyes. And I'll request all our speakers to please stick to time, otherwise we are going to roll over into the next session. So let's just stick to our time. Thank you.
I would like to congratulate and thank AIOS and Uttarakhand Ophthalmological Society for this wonderful conference. I'll be speaking on dual polymer advantage in management of dry eyes. I have no financial interest to disclose. So as we have already discussed, dry eye poses a significant burden to the society in case of number of people affected, the impact on the quality of life, as well as the economic burden on the society. And 1 in 4 patients attending our OPDs report to us with the symptoms of dry eye, and it is one of the most common complaint seen by us. And the prevalence of dry eye is very high, ranging from 5% to 33% of the adult population. So the management of dry eye disease, as discussed, the diagnosis definitely precedes the therapy, and we really have to identify the underlying ocular surface condition and assess the major causative factors which are involved. The dry eye evaluation involves some mandatory tests and some non-mandatory. The mandatory, as already discussed by the previous speakers, staining, Schirmer's test, tear breakup time, and mammography, and certain non-mandatory tests which are for the research purpose also. So the stepwise approach to management of dry eye involves, the first approach involves the education of the patient regarding the potential dietary modification, lifestyle modification, and we do start with ocular lubricants of various types, along with lid hygiene and warm compresses. Then we go on to the non-preserved ocular lubricants, moisture chamber spectacles, goggles, overnight treatments, LipiFlow, other topical antibiotics, corticosteroids, secretagogues, and cyclosporins. Then we move on to autologous serum eye drops, therapeutic contact lenses, soft bandage lenses, and rigid scleral lenses, according to the underlying ocular surface condition involved. Then we have topical corticosteroids, amniotic membrane grafts, punctal occlusions, and other surgical approaches, as already been discussed. But still, the artificial tears remain the mainstay therapy for the management of dry eye disease. This is done to enhance the lubrication and prolong the retention time on the ocular surface, depending upon the viscosity enhancing agents. So coming to the generations of the tear substitutes, we started from a saline isotonic hypertonic solution, which usually had back, and now we have come to the 4th generation tear substitutes, which are artificial tears with the lipid component. So the most commonly used viscosity enhanced agents or lubricants we have range from polyvinyl alcohol, HPMC, CMC, polyethylene glycol, and now we have sodium hyaluronate. So when this polyethylene glycol is exposed to a higher pH of ocular surface and the tears, which is approximately 7.5, this HP guar and polyethylene glycol formation forms a reversible cross link with the borate, resulting in a gel matrix with the mucin layer of the tear. This gel matrix is designed to promote the retention of the active demulcents, and it thus protects the ocular surface. The gel transformation is designed to promote the increased contact time, while its liquid state in the bottle allows for the ease of application. So this pH gelling technology improves the retention time of the formulation and provides the increased relief from the symptoms of dry eye. So there comes the mucomimetic action, tear film maintenance, and the protection of corneal epithelial cells. Coming to sodium hyaluronate, as we all know that in the eye it is found in the vitreous and also in a much lower concentration in the aqueous humor. This HA is a natural component of tear with the proportion of that on the ocular surface being synthesized on the corneal epithelial cells. Hyaluronic acid effectively binds water and assists dehydration, promotes epithelial wound healing, and the viscoelastic properties enhance the residence time. So owing to the large number of negative charges on this molecule, sodium hyaluronate leads to a greater capacity to hold the water than any other natural or synthetic polymer. Hence, the evaporation of water from HA eye drops is slow and the beneficial effect is definitely prolonged. So how does this hyaluronic acid promotes corneal wound epithelial healing? There is fibronectin and extracellular matrix protein which stimulates epithelial cell migration and definitely accelerates the healing of the corneal epithelial wound. So any kind of shear stress, that is the force between the tears and the ocular surface, is protected by the viscous properties of this liquid and the elastic properties of the solid. So during blinks, any shear stress causes the molecules of HA in a solution aligned with one another. And this solution becomes elastic and relatively non-viscous and spreads easily over the surface of cornea. Consequently, the tear film is stabilized and the residence time of the solution is increased. So here we have the combination of polyethylene glycol, HP-GOAR, and sodium hyaluronate. The pH gelling technology of HP-GOAR provides prolonged lubrication, acts as a mucomimetic solution, accelerates corneal epithelial wound healing, and promotes water retention due to hygroscopic properties. So this dual polymer increases the tissue hydration time, lubrication, and it protects against the ocular surface damage. So this improved tear film stability is much better than individual polymers, and it protects against any kind of ocular surface damage that is associated with the dry eye disease. So the improved lipid layer thickness due to sodium hyaluronate and viscosity adherence and better lubrication with polyethylene glycol and HP-GOAR combination, along with the improved mucomimetic action. So we have clinical research supporting all these claims. Like there is a study with polyethylene glycol and HP-GOAR combination along with HA, which shows that there is immediate effect of this combination, and the changes in the TBUT after 60 minutes of instillation is statistically significant. Moreover, the immediate effect of HA and HP-GOAR combination on the tear film stability is also seen with change in the tear meniscus after 60 minutes of instillation, which was also found to be statistically significant. And 1/3 of the patients undergoing cataract surgery who usually complain of dry eye symptoms, we found that there is improvement in the ocular discomfort with HP-GOAR combination and hyaluronic acid drops post-cataract surgery. So this HP-GOAR and hyaluronic acid combinations are effective in reducing post-cataract surgery ocular discomfort, and there is improvement in tear film stability as well. The study found that the dual polymer is associated with greater cell viability than the individual single polymer formulation, and this confers greater desiccating resistance and possibly through better hydration and enhanced retention time. So the take-home message is that this particular dual polymer tear substitute provides increased tissue hydration, better lubrication, and definitely protects against the ocular surface damage. associated with dry eye, and it helps maintain the tear film stability after cataract surgery, and there is greater cell viability than the individual single polymer. Moreover, there is better reepithelialization of the corneal wound by the accelerated wound healing process. Thank you. I would like to thank Cipla for this new polymer in the.
Thanks, Dr. Anu. I had a question for you. For post-refractive surgery, dry eye, so one in patients who don't individually have dry eye to begin with, and vis-a-vis those who will, already had some pre-existing dry eye, how would you tailor your, post-operative lubrication, which means that a routine patient who had no dry eye to begin with, you would obviously use lubrication at that point post-op for them anyway. And then another patient, who had some dry eye to begin with, would you treat them differently, and how does, this have a role there, and what product you would choose, like which formulation you would choose best? Because
It's definitely a polymer with a better retention time. And we have to make sure that the compliance is better than any regular patient with no dry eye. Moreover, the lubrication has to be increased, taken for a longer period of time. Like you cannot taper off like quicker.
what's the usual duration that you would give lubricants for, like post-refractive surgery?
Sir, if we doubt that patient is patient is having dry eye, we continue for 6 weeks at least.
And have you seen a difference between various refractive surgeries, like for the requirement for like post-refractive surgery dry eye, like lenticular extraction versus surface ablation versus, like a flap-based procedure? Would you find differences, and have you changed the duration of lubrication required for each of
Yes,
these
sir,
groups?
definitely with surface procedure we increase the
You use
lubrication
it for
time.
longer, right?
Better.
Thank you, sir.